If you are 70 years old, put your mind in these signs to determine heart disease. The heart stands as a vital cornerstone of human physiology, serving as a tireless pump that ceaselessly circulates life-sustaining blood throughout the body. Recognizing its indispensable role, it is imperative to prioritize heart health. Unfortunately, heart disease casts a long shadow over global health, emerging as a leading cause of mortality that indiscriminately afflicts individuals of all ages and genders. This complex malady encompasses a diverse array of cardiac afflictions, including those that compromise the intricate network of blood vessels, disrupt the heart's delicate electrical rhythm, originate from congenital abnormalities, or impair the structural integrity of the heart muscle and its vital valves. Coronary artery disease, CAD, a condition characterized by the narrowing of blood vessels supplying the heart, remains the world's most lethal ailment. This insidious disease often progresses silently, its presence veiled until symptoms emerge beyond the chest. Irregular heart rhythms and the oppressive discomfort of angina are among the potential manifestations. A heart attack, the catastrophic culmination of untreated CAD, poses a grave threat to life. Early detection is paramount in combating this formidable disease. Recognizing the diverse and often subtle signs of heart trouble empowers individuals to seek medical attention promptly. Such proactive care is instrumental in mitigating disease progression and averting potentially fatal complications. Moreover, the intricate interplay between heart disease and other chronic conditions, such as diabetes, hypertension, and obesity, underscores the importance of comprehensive heart health management. By adopting a heart-healthy lifestyle, undergoing regular checkups, and possessing a keen awareness of heart disease symptoms, individuals can significantly reduce their risk of experiencing a life-altering cardiac event. This proactive approach, coupled with advancements in medical care, offers hope for a future where heart disease is more effectively prevented, treated, and ultimately conquered. The journey toward a heart-healthy life necessitates a holistic approach encompassing diet, exercise, stress management, and smoking cessation. Regular monitoring of blood pressure, cholesterol levels, and blood sugar is essential for identifying early warning signs of cardiovascular trouble. Moreover, emerging technologies such as wearable devices and artificial intelligence hold promise for enhancing heart disease prevention and management. Ultimately, the battle against heart disease is a shared responsibility. Healthcare providers, researchers, policymakers, and individuals must collaborate to foster a society that prioritizes heart health. By investing in education, prevention programs, and accessible healthcare, we can collectively work towards a future where the burden of heart disease is significantly reduced. Chest discomfort is often the first indication of underlying heart issues. However, it's essential to differentiate between ordinary chest pains and those linked to the heart. Cardiac-related chest pain typically manifests as a sensation of pressure, tightness, or squeezing. This discomfort can be intense, often likened to having an elephant sitting on your chest. Unlike general aches, the pain associated with heart problems frequently extends beyond the chest. Common areas where this pain can radiate include the left arm, neck, jaw, and even the back. The left arm pain is particularly noteworthy. It can range from a dull ache to a sharp shooting pain and might affect the entire arm or just its inner portion. Similarly, neck or jaw discomfort can vary from a mild ache to a sharp pang. Intriguingly, some individuals experience heart-related pain in the upper or middle back. This atypical presentation can often lead to misdiagnosis. The root cause of this discomfort lies in the heart muscle's inadequate oxygen supply. This is typically due to narrowed or blocked coronary arteries, which are responsible for delivering oxygen-rich blood to the heart. Physical exertion or emotional stress can exacerbate the pain as the heart's oxygen demand increases. Conversely, resting typically provides relief as the heart's workload decreases. It's crucial to emphasize that seeking immediate medical attention is paramount if you experience chest pain, regardless of its severity or duration. This symptom could signal a heart attack, a life-threatening condition requiring prompt medical intervention. While chest pain is a prominent symptom, it's not the sole indicator of heart problems. Other symptoms, which we will explore in the next section, can also be crucial warning signs. Understanding the characteristics of heart-related chest pain is vital. It's essential to dispel the common misconception that heart pain is always a sharp, stabbing sensation, as often portrayed in media. It can be a subtle pressure, a dull ache, or a feeling of heaviness. Recognizing the potential seriousness of this symptom empowers you to take swift action if necessary. Remember, early intervention is key in managing heart conditions effectively. By familiarizing yourself with the diverse manifestations of chest pain associated with heart problems, you can become a more proactive participant in your healthcare. It's crucial to listen to your body and trust your instincts. If you experience any unusual or persistent chest discomfort, don't hesitate to seek medical evaluation. Early diagnosis and treatment can significantly improve outcomes for heart conditions. While perspiration is a natural bodily function, especially following physical exertion, the sudden onset of profuse sweating during periods of rest or relaxation warrants serious attention. Commonly referred to as cold sweats, this physiological response often signals the body is under significant stress or experiencing intense pain. One of the most concerning scenarios in which cold sweats manifest is during a heart attack. When the heart muscle is deprived of oxygen due to blockages or narrowing in the coronary arteries, a complex physiological cascade is initiated. The body's stress response is activated, leading to the release of adrenaline and other hormones. These substances induce a series of changes, including the constriction of blood vessels near the skin's surface. This vasoconstriction serves to divert blood flow towards vital organs like the heart and brain. Simultaneously, the body attempts to regulate its temperature through increased perspiration, resulting in the characteristic cold sweat. Often, cold sweats are accompanied by a constellation of other distressing symptoms. Dizziness can arise from reduced blood flow to the brain, while nausea may be a consequence of the body's overall state of distress. A profound sense of anxiety is frequently experienced as individuals become acutely aware of their body's abnormal functioning. It's essential to emphasize that while these symptoms can be indicative of a heart attack, they can also be associated with other medical conditions. Therefore, seeking immediate medical evaluation is crucial if you or someone you know experiences unexplained cold sweats accompanied by any of these symptoms. To illustrate, consider a person who is quietly relaxing at home after a satisfying meal. Suddenly, they begin to sweat profusely, despite the comfortable room temperature. This is accompanied by a disconcerting dizziness and a wave of nausea. A sense of overwhelming anxiety washes over them. In such a scenario, the possibility of a heart attack cannot be dismissed. Prompt medical attention is paramount. It's crucial to recognize that the earlier a heart attack is diagnosed and treated, the better the chances of recovery. By understanding the significance of cold sweats and their potential association with heart problems, individuals can become more proactive in safeguarding their health. It's essential to dispel the myth that heart attack symptoms always involve dramatic chest pain. Often, the initial signs can be more subtle and easily overlooked. Remember, prevention is key. Maintaining a healthy lifestyle that includes regular exercise, a balanced diet, and stress management can significantly reduce the risk of heart disease. However, it's equally important to be aware of the warning signs, such as cold sweats, and to seek medical attention promptly if they occur. Early intervention can be life-saving. If you have any concerns about your health or experience any unusual symptoms, please consult with a healthcare professional for proper evaluation and guidance. Swollen ankles, medically termed edema, can be a subtle yet significant indicator of underlying heart issues. This condition arises from a disruption in the body's fluid balance, often stemming from the heart's inability to efficiently pump blood. Our cardiovascular system operates as a finely tuned network, with the heart acting as its central pump. When the heart's pumping power weakens, as in the case of heart failure, blood can accumulate in the veins, particularly those in the lower extremities. This congestion leads to increased pressure within these vessels, forcing fluid to seep out into the surrounding tissues. The ankles, being the lowest point in the body, are especially susceptible to this fluid buildup. Several factors contribute to ankle swelling in heart failure patients. Gravity plays a significant role, as the blood tends to pool in the lower extremities when a person is standing or sitting for prolonged periods. Furthermore, the heart's reduced pumping capacity hampers the return of blood to the heart, exacerbating the issue. As a result, individuals with heart failure often experience a noticeable increase in ankle swelling towards the end of the day. It's crucial to differentiate between ankle swelling caused by heart problems and that resulting from other conditions. While kidney disease, liver disorders, and even pregnancy can lead to edema, the context of additional heart failure symptoms is essential. Shortness of breath, fatigue, rapid weight gain, and a persistent cough are often associated with heart failure-related ankle swelling. To illustrate, consider an individual who notices a gradual increase in ankle size over several days. Initially, they might attribute this to increased physical activity or dietary changes. However, if the swelling progresses, becomes more pronounced in the evenings, or is accompanied by shortness of breath, it's imperative to seek medical attention. Early detection and management of heart failure are paramount in improving patient outcomes. By recognizing the potential significance of swollen ankles and seeking appropriate medical evaluation, individuals can take proactive steps to address underlying heart issues. Routine checkups, including blood pressure monitoring and regular weight checks, can help identify early signs of heart problems. Remember, ankle swelling should not be dismissed as a minor inconvenience. It can be a valuable clue to a more serious underlying condition. If you experience persistent or worsening ankle swelling, it's essential to consult with a healthcare professional for a comprehensive evaluation. Early diagnosis and treatment of heart failure can significantly improve quality of life and prognosis. Shortness of breath, medically termed dyspnea, is a distressing symptom that can significantly impact quality of life. While it's normal to experience labored breathing during intense physical exertion, persistent shortness of breath even during rest or light activity should not be ignored. It can be a telltale sign of underlying heart problems. The heart is a tireless pump, continuously circulating blood throughout the body. Oxygen-rich blood is delivered to the lungs, where oxygen is absorbed and carbon dioxide is released. The heart then pumps oxygenated blood to the body's tissues. When the heart's pumping efficiency is compromised, as in heart failure or coronary artery disease, several complications can arise. One common consequence is fluid buildup in the lungs, a condition known as pulmonary edema. As the heart struggles to pump blood effectively, pressure backs up in the pulmonary veins, causing fluid to leak into the lung tissue. This excess fluid interferes with the lung's ability to expand fully, making breathing difficult. Individuals with heart failure often experience a worsening of shortness of breath when lying down, a condition called orthopnea. This occurs because the fluid in the lungs redistributes when a person is recumbent, making it harder to breathe. To alleviate discomfort, they may resort to sleeping in a semi-upright position using extra pillows. It's essential to recognize that shortness of breath is not exclusive to heart problems. Other conditions, such as lung diseases, anemia, and anxiety, can also cause this symptom. However, when shortness of breath is accompanied by other heart-related symptoms, like fatigue, swelling in the ankles, or chest pain, it's crucial to seek medical evaluation promptly. For example, consider a person who initially notices mild difficulty catching their breath while climbing stairs. Over time, the shortness of breath progresses to the point where they feel winded after walking short distances or even while resting. If this is accompanied by swelling in their ankles and a persistent cough, it's highly suggestive of heart failure. Early detection and treatment of heart failure are vital for improving prognosis and quality of life. By recognizing the significance of shortness of breath and seeking medical attention when necessary, individuals can take proactive steps to manage their heart health. Remember, if you or someone you know experiences persistent shortness of breath, it's essential to consult with a healthcare professional for a comprehensive evaluation. Early diagnosis and treatment can make a significant difference in managing heart conditions. These are merely a glimpse into the complex world of heart health. Remember, each individual's experience with heart disease is unique. While these symptoms might signal potential issues, they aren't definitive. A comprehensive evaluation by a healthcare professional is essential for accurate diagnosis and appropriate treatment. If you've been identified as having risk factors for heart disease, such as high blood pressure, high cholesterol, diabetes, smoking, or a family history of heart problems, regular checkups and adherence to preventive measures become even more crucial. Early detection and management are key to maintaining heart health and preventing serious complications. Don't hesitate to consult your doctor if you experience any concerning symptoms or have questions about your heart health. That concludes our talk for today. Thank you for joining us. If you found this information valuable, please consider subscribing to our channel. You can also share it with your friends and family. Remember, you're always part of our community here. We look forward to connecting with you again soon.